Yes, ma'am.
A very good evening to our distinguished guests, respected faculty members, mentors, and my dear colleagues. I'm Jeevana, and on behalf of the Indian Medical Association, Tamil Nadu State Branch, it gives me immense pleasure to welcome you all to RIT25, the one-on-one research mentorship program. This initiative stands as a true reflection of the vision of our patrons, the guidance of our state leaders, and the unwavering commitment of our mentors who continuously inspire young minds to question, explore, and excel in research. A special note of gratitude to our organizing secretary, Dr. G. Arunagiri sir, for this remarkable efforts in bringing this mentorship to life. This evening session, titled Designs That Define the Direction of Discovery, Study Designs and Research, focuses on understanding how every great research begins with the right design and direction. It is an honor to introduce our distinguished resource person, Dr. R. Uma Maheshwari, Professor, Institute of Community Medicine, Madras Medical College. Her expertise and passion for research continue to inspire and guide countless budding researchers across Tamil Nadu. With great respect and enthusiasm, let's extend a warm welcome to Dr. Uma Maheshwari, ma'am. Ma'am, the stage is yours.
Thank you, Ma. Thank you for your nice words.
Thank
I
you.
want to know the base of the audience. Who are all they?
Ma'am, these are the audience who've been working on research and they have completed the. They are working on their protocols, ma'am, as per
Yeah,
now.
yeah. Maybe first years and second years. Or a
Ma'am,
mixed
third year is
group.
also there, final
Third
years
years
is
also.
also mixed
Okay,
group, ma'am. They
no
have
problem.
basic research knowledge, ma'am.
Yeah, I'm only taking only basics. That's why I want to know it. Okay, thank you, Ma. Thank you so
Yes,
much.
yes,
Okay.
yes.
Good evening to all. Today I will discuss the basic study designs and how to choose an appropriate study design for your research question. So where we all stand is, my presentation will be an overview of study design, tree and how to spot the study design and choice of your study design based on your research question. So first, where you stand now is you have already done your background and you justified why I have started your study and your objective of your research. And the objective of your research question only is going to decide the entire methodology of your research. So in the entire methodology, the first begins with your study designs. So these are the basic study designs which starts from case report, case series, ecological study, cross-sectional, case control, cohort, and RCTs. So this case report usually generate hypothesis. This will tell us there is some association between some risk factor and a disease, or some groups are at high risk of developing a disease. That is your generating hypothesis. As you design down, you are going to confirm this statement whether there is truly and relationship exists between the cause and the disease. That as you go on, your RCTs, cohort studies goes. Above RCT, you have your systematic review. That is not your basic study design. That is not the primary study design. So here the primary study designs are again divided into experimental and observational study. What is observational study is you simply observe what happens in the community. You don't intervene. As a researcher, you will not do any interventions. If you do intervention by means of any cessation experiments or education, health education, vaccination, that becomes your experimental study. So if you are just observing, that is observational study. If you are intervening or doing some experiment with human research participants, then it will become as an experimental study. Your observational study includes your case report and case series. I will describe each and everything in a simple manner only. I'm not going to tell all the steps. So what is the basic study design is case report. This is the basic one. It gives a detailed report of the profile of a single patient. It always document unusual medical occurrence. It gives first clue in the identification of a new disease or adverse effect of exposure. If you are seeing any adverse event of any drug unusual in this condition, if you have not written in your pharmacology books, then you are reporting it as a case report. For example, this is a case report where they studied about drug-induced myopathy in a patient with pulmonary tuberculosis. So case series is nothing but a collection of your case reports. This is collection of an individual case report that occur within a short period of time. So what's going on now? This is a cold reef issue. So you have seen somewhere 2 states were reporting deaths due to cold reef syrup within a short period of time. This is called your case series. This comes under your case series. For case series, there is no number. More than one constitute your case series. So it's identify the presence of beginning of an epidemic. So these are the basic case report and case series. Next comes your ecological study. Here it differs. Usually, as a student, we will not be doing it. To some extent, we can also try this model. So here, you will not collect data from the individual. This is the data about the group. So data usually collected from the existing public resources. If you want to study about the cancer, you will prevalence, you will get the details from your cancer registries like that. So you will be collecting from the existing public resources. It is useful for generating hypothesis rather than proving them. It will give us some statement. So it is common in environmental and population level health research. I'll just explain this with some example, then I'll come to your ecological fallacy. So here's somebody wants to study about the lung cancer and cigarette consumption across countries. They just collect the data about the sale of cigarettes from some public departments and lung cancer from the our cancer registries. So this is only group data. It doesn't have any individualized data, but it will be there. When you're presenting, it will be about for a group. So assess whether cigarette correlates. When the region where there is an increase consumption of cigarettes or increased sale of cigarettes and the prevalence says there is a higher prevalence. They say those who where cigarette sale is higher, there is a higher prevalence of lung cancer, but we don't know the individual data, whether somebody may not have the disease, some may have, some may not consume even cigarettes. We don't know whether the patient is smoking cigarettes or not. We don't have the individual data currently. Here the population unit is a country, the exposure variable is per capita cigarette sale, your outcome variable is lung cancer mortality rate, and you find an analysis. This is what do you mean by ecological fallacy is you don't know the data variability between the individual. We give a data for a group that is all a geographical area. We don't bother about the individual data, whether they smoke cigarette or not, or whether they have those who have smoked have lung cancer or not. So this is a basic study which we so here the advantage of this ecological study is you generate hypothesis. It helps us to target the high risk population, geographical region and time period for further studies. And then comes the cross-sectional study, which we commonly does in our areas. So because this is easier. So cross-sectional study is otherwise known as prevalence study. So what do you mean by cross-sectional? This is a single examination of a cross-section of a population at one point of time. You just decide one study. I want to study the prevalence of anemia among medical college students. You just go to the medical college student. There will be 5 batches. You just study estimate the prevalence of anemia either clinically or by any blood test. That is only at one point of time. You will not follow up them or you will not do anything for them. So just at one point of time, you estimate and you report. That is called your cross-sectional study. Here, exposure and effect are measured at the same time. Here, exposure, effect is anemia. Exposure may be you are not eating a diet rich in iron, or you may be not wearing a slippers, you are not dewormed. So many risk factors, exposure factors, which are you may have any malarial infection, hookworm infection, like that you can go ahead. So all this you will go and ask whether you have anemia, whether you have all these factors. This exposure and effect are measured at the same time and there is no follow-up. So this is very simple. You just go and survey at a single point of time and give your finding, that is cross-sectional study. The one thing you remember, the exposure and effect are measured at the same time, no follow-up. So this is the which I have. This is a group of, if I'm sampling a reference population as a medical college students, so I can't study the entire Tamil Nadu. So I choose one or two medical colleges. So I will go and sample them. We always calculate sample size and I'll calculate my study population as the medical college which I have chosen as a sample. So from there also I may not able to study, and you can use your calculate your sample size. I may take 50 students from first year, the 50 students from second, and 50 students from phase 1 and part 3, uh, phase 3, part 1 and part 2 also. So you can divide among yourself your study population. The study population is called as who is accessible for your study is called your study population. From your findings, for whom you want to generate or you want to generate findings to them is called reference population or your target population. So study population is who is accessible for your study is called your study population. So then you have chosen your students for your study. Then you gather data on exposure and disease. Here I will take anemia is a disease. You will estimate the whether anybody suffers from anemia or not, either clinically or uh, blood test also you can do. Exposure, I'll consider as whether they suffer from malaria disease in the last 6 months. So I'll ask them. So I'll classify them as those are anemic and not anemic. And I'll ask whether there is whether they suffer from malaria in the last 6 months. That is the factor present or absent. This is only thing you are doing. The study only exists at only one point of time. No follow-up. You measuring both exposure and outcome at the single point of time. So this is the main feature of cross-sectional study. So here I give an example. If I want to study the prevalence of hypertension among adult male population, so I want to know hypertension has different risk factors, maybe a lifestyle issue. I take it as a smoking as a risk factor. Just putting for an example, there will be so many risk factors for developing hypertension: diet, salt intake, exercise, whatever. Here, for example, one table I have taken as lifestyle issue. I'll give you as smoking. So here always outcome has to be defined. So whatever, when you are measuring any outcome, there should be some operational definition. How I am going to define this patient has a hypertension or not. I am going to take 3 readings at 5 minutes interval, whether I'm going to take the average or I'm going to take the least reading as per some definition you can take. So I have put it as per WHO guidelines. So here you are doing some analysis. You come up disease present, hypertension present, absent, and your exposure present, absent. You do some analysis. You can even calculate your odds ratio. You can tell. This is the analysis part of your cross-sectional study. So here advantages, as you go and you measure, it is easy to estimate the burden, disease burden. So you can do this study in a short duration of time. That's why it is mostly preferred and it is convenient for us and it doesn't require much time or money factor. So it is inexpensive to carry out. It can consider several exposure and several disease at the same point. What you want to measure, you can take. And it helps us to generate some hypothesis. There is some association. I'm not putting it as a causal relation. There is some association between some risk factor and disease. Disadvantage, it is a weakest observational study as it measures only a prevalence. Usually the prevalence are considered as survivors. Those who have survived out of the disease only come out in your prevalence study. That's why it is considered, it measures only a prevalence, it not as incident. and you doesn't know which exposure has started first or effect has started first. You doesn't relation should be in the temporal association. Lung cancer வந்ததுனால அவன் smoke பண்ணனால அவன் lung cancer. This your temporal association it's very difficult to find out. That's why. And rare diseases will be difficult to get it in your survey. Condition of short duration, they will recover, so they may not be included in a part of a study. And disease with high case fatality rate also will not be a part of it because they die as earlier. So these are the drawbacks. Rare disease, shorter duration disease, and disease with case fatality are difficult to get detected by your cross sectional study. And it provides little information about the natural history. To study the natural history, the best study is your cohort study. So it starts from your pre-pathogenic phase to your pathogenic phase. So that ends your observational study design. That these are case report, case series, ecological study, and your cross-sectional study comes under your descriptive observational study designs. So this only when you see a new patients with new, you are going to give a case report. So again, the most commonly used study design by the students are the cross-sectional study. So next comes your analytical study. You have there is some relationship between some factor and the disease. I want to confirm. So to say whether the diseased individual have this risk factor, you always need a comparison group. That's these people have higher risk. So this is useful for testing a hypothesis. Here, the control groups are required for testing the hypothesis, and it should be the control group should be carefully designed by the investigator, chosen by the investigator. It evaluates the association between suspected risk factor and the disease. So here you have two study designs, that is your case control and cohort. Here the difference between case control and cohort is where your study begins. That is the main factor. Whether I am choosing the study with the diseased individual or I am choosing the study with the exposed individual. As name instructs, case control design. The person is already diseased. So always you begin a group of patients with a disease cases and control. A patient with lung cancer, patient without lung cancer, and you ask whether you smoked in the past or not, whether you have this risk factor or not. Thus, you classify. This is your case control study. That is not, you can't tell it as whether I'm asking retrospectively. That is not the difference between case control because you have a retrospective cohort study also. So since where you begins, that is the main factor, not the calendar time. So if you begin with a case and another with control group, then you ask whether you have the risk factor, whether you have been exposed to the risk factor or not. That comes your case control study design. So this is also easier because already disease has occurred. Here, I want to study whether exposure to second-hand smoke, that is your passive smoking, is fine has an association in low birth weight among pregnant women. For this, I have to be here. The outcome is low birth weight. Here, the disease is considered as group of babies with low birth weight. And mother is the one. Mother with a low birth weight babies will be taken as a case. Mother with low birth weight babies taken as case. Mother with normal birth weight taken as a control. And you ask for whether you have been exposed to second-hand smoke or passive smoking in the during your pregnancy. That is your exposure factor. So then compare the two groups where it is higher prevalence of this risk factor. So here analysis, you have a diseased individual is your case and is the mother with low birth weight and mother with normal birth weight. You have been asking passive smoking or exposure to second-hand smoke, press or not. Then you calculate. As you already read, your measure of association is odds ratio in your case control ready. If you find your odds ratio as 1, there is no association between the risk factor. If it is more than 1, there is a positive association between a risk factor. If it is a negative, it has given a protective. So advantage is relatively, it is easier to carry out because taking exposed and non-exposed and following them for the development of disease in the case of cohort study, it takes a longer period. So here you're already starting with the diseased individual. So it is a relatively easy to carry out and it's a less expensive. When there is a disease already developed, you can ask for the multiple risk factor for a single disease. So whether even you take a lung cancer, not a smoking, any occupational exposure, any alcohol, all this your risk factors you can ask. So multiple risk factor can be elicited for a single disease. It's very optimal for the evaluation of a rare disease because the rare disease is difficult to find out in your uh, cross-sectional study. If it is a cohort, you have to have such a longer period, maybe 25 to 30 years, you have to follow up them. So very difficult. So for rare disease, you can choose a uh, case control study. It also relatively, as I said, relatively useful for evaluation of a disease with a long latent period. So disadvantages is we cannot calculate incidence because already this patient has been developed a disease. And also the relationship, it is also difficult to establish between this. And already the case choosing a case, and when you ask patients with a mother with a low birth baby, they will tell all small factors also a risk factor for the baby to have a low birth. So they will be, there is chance for recall bias, but the mother with normal birth weight baby will not remember fewer things easily. But so this is a prone for your selection and recall bias. So another case study design is your cohort study design. Here you begin a study with cause to effect. You will take individual, a group of population and you divide them into smoker and non-smoker. That is your factor exposed and non-exposed. And you follow up them for development of lung cancer. This is your, so your, when you're starting your study design, the patient should be free from a disease. So there should be you should rule out the presence of disease in the individual and you classify them based on your exposure and non-exposure. Then you look for this follow-up period. So your study design starts with exposed disease-free individual with exposed and non-exposed and you follow up them to develop a disease or not. It is in your feature. Where you begin the diseases, you begin your study with the disease-free individuals, but they have some exposure factor. This is your cohort study. As you follow up them, you can study the natural history of the disease and also you can calculate the incidence. Here, analysis, you begin first select those patients with exposed to risk factor and non-exposed, then follow up them to see whether they are diseased or not diseased. Here you can calculate the incidence. So you calculate your relative risk or risk ratio. That is our incidence among exposed and by incidence among non-exposed. So all this basic study designs you can refer from your community medicine, any textbooks, which is so the same thing as I said for your odds ratio. So in RR1 is have no association, RR more than 1 have positive association, RR less than 1 indicates negative. It gives you a productive effect or the benefit to the risk factor. So advantages is it gives you a temporal relationship. Those are how they develop the disease as in real life. It helps to calculate incidence. You can calculate several outcomes related to exposure simultaneously. Relative risk can be bias is minimized here. So disadvantages here you have to have a large number of people and long time because you're doing a follow-up. So many will be missed from your follow-up. Many may die, the investigator move out, all this. You have administrative and logistic problem. Loss of substantial purpose. As you follow, some may change some may die off, some may move out, migrate. So it is not useful in disease with long latency, because following up for such a long period of time is very difficult. So you can have it as for sure. Before planning a cohort study, you should know the um, at least the disease development period or latent period. So this ends with your observational study design. To sum up, the observational is you just simply observe where you don't intervene. Your observational divided into descriptive and analytical. Under descriptive, you have your case report, case series, ecological study, and cross-sectional study. In your analytical study, you have your case control and cohort. Your case control, you begin with effect to cause, that is outcome to risk factor you're going to study. In your cohort study, you're starting with your exposure to effect or exposure to outcome. So that comes your experimental study design. So here, interventional studies where the investigator exposes the study subject to an intervention. Here you can't allow you can't say a patient to smoke. I want to study the outcome of effect of smoking on your health. This we can't do it because it is ethically wrong. So this you can do some benefits like asking, giving some health education, vaccination, or cessation health education. You can do this, some intervention which is going to benefit the students. This is mainly to evaluate the efficacy and safety of the intervention. Even you can give a newer drug, so you may feel some this drug is better than this drug in treating some conditions. Anything you can do, but it should be benefit to the patient. It should not harm the patient. So times you have randomized control trial and non-randomized studies. So you should select a suitable population whom you want to study. So and then you choose your select suitable sample. You get your consent. Then those who are not eligible, you can remove them, make necessary exclusion, whether they are included not or whether they're not shooting the eligibility criteria of this, you can remove them. Then you randomize them. Here you are not. This randomization helps to avoid your subjective bias. For this patient, I will give this. You can't do it. You can have your allocation consignment. So when the patient comes, you can take your allocation consignment, see which arm this patient will go. So you can divide into 2 arms or many arms. So interventional group and control arm you can take, and you follow them similarly. That is that not putting much effect to intervention group and not giving uh, uh, any concentration to your control group. Like that, it should not be. It should be very similar. If you're following them every month, you should follow your control group out also at 1 month. So this you follow up them and you get your assessment whether they are developed a disease or whether the what were the benefit you have, whether the this drug has reduced the occurrence of any infection, opportunistic infection, all this, or whether it has controlled the BP well than compared. So because the control group, you should not give placebo. The control should have the standardized treatment. So if you're not giving the standardized treatment, it is also unethical. So your intervention should be above the standardized treatment. So all patients will be similarly receiving the standardized, and the intervention group will receive what is your additional intervention. This is important point you should remember. So advantage is more convincing evidence it gives because it is a prospect way. So disadvantage is very difficult to go. It's expensive. Again, this patients is difficult to follow. They may last. It's unethical to assign a person to certain treatment or comparison group. That's why you don't use the subjective. Somewhere to avoid this, you have allocation consignment and your randomization process. So coming to this tree, I want to know now you are going to do how you are choosing your study design. Whenever you plan your research, you should put first whether I am assigning the exposure or not. First, you should put your question in your mind. If yes, that comes under your experimental study. Whether I'm doing a random allocation or such is like a comparing before and after, that decides. So if you're randomly allocating the study subject to control or to intervention group and control arm, that comes your randomized control trial. So if you are assigning your exposure, that is your experimental study. I am not assigning exposure. That is, then comes your observational study. Then you see whether I'm studying in a single group or in a two group. That is your comparison group. If I am using a comparison group, then it comes your analytical study. Then if no, it goes to your case report, case series, and your cross-sectional ecological study. If coming to your analytical study, which direction? That is important. Whether I am coming from exposure to outcome. If it is exposure to outcome, then it will be a cohort study. If it is from your outcome to the exposure, then is your case control study. Then exposure and outcome are measured at the same time. You have your cross-sectional study, you have a descriptive cross-sectional study and analytical cross-sectional study. When you find some association between using your odds ratio or you are simply describing by the time, place, person, then it will be coming in your descriptive cross-sectional study. If you are describing, it will come in an analytical cross-sectional study. So how I choose this, which study design I'm going to choose. So any research question you can do in any now, this all the four study design. But what factor is deciding which study design I should choose is your research question. Whether I'm going to use my comparison group or not, whether I'm going to compare with someone or not, your research question is going to design because you're going to frame your research question according to that. Second is ethical consideration is going to change, and your time, whether I want to finish the study in a short period of time, can I go for a longer period of time, your study design depends. Then your resource, how many resource I have, whether time, money, resource persons, how many number I have, this resource, time, man, money, material, all this decides which factor I'm going to choose. So another thing is this I want some interaction from the people. Uh, you have chosen your study research question, no? What format you have typed? You may have done it. So I want some answer. When you're framing research question, there are some formats, no? So which format you have used in your research questions?
If it's a qualitative study, we go with spider format, no?
Qualitative study is different. What you used?
Spider format.
Good. Spider format you have used. Good. Another anybody quantitative studies?
Pico format.
Because Picot format. Very good. So based on this also you can choose which study design it belongs. That's why I want to do this. So this is based on it. This is all studies. When you use PO format, that comes your descriptive study. The question number 1, I'll go back. Next slide I'll show. If you are using only population outcome, it is going to be your cross-sectional study or qualitative study. So if it is an analytical study, you have population, exposure, comparison group, and outcome. E, that is PECO. If it is ICE intervention, that comes your experimental study. So PICO format or PECO format is for analytical study, only PO it is going to be. The same thing. This is I want to know how you decide on your research question. So what was the aim of the study? I want to simply describe a population. You use your descriptive, that is PO questions, study designs, descriptive. Simply I want to describe, it's a descriptive cross-sectional study. So I want to quantify the relationship between factors, that is PICO, use your analytical, that is PECO. If analytical, you see whether the intervention was randomly allocated here. So if it is randomly allocated, you're going to for experimental. If no, you're going to go for your observational study. When was the outcome determined? That is your direction. Sometime after exposure or intervention. It's a cohort study. So at the same time as the exposure or intervention, it's your cross-sectional study or survey. or before the exposure was determined? Your outcome was decided before the exposure. That is your case control. Your disease has already occurred. So this is your basing, spotting the study design based on your Picot format. So I want all 26 is there. I may be on including me or something. So I want the other 20 to form. Four, I want to, does hormone replacement therapy reduces or cause coronary heart disease? Because it may reduce or it may cause harm in any coronary heart disease risk in postmenopausal women. I want you to all write how I will, all the four study designs, case control, cohort, RCTs, and cross-sectional. So how will you begin and how will you end your study designs? You can choose. So just for 2 to 3 minutes, so you can try and present to me. Is it okay? Someone can respond?
Yes.
Yes, yes. Just 2 5 minutes. You can see where I begin. That's all. So who is my diseased individual or who is my exposure, how I begin my study. That's all. Just to understand concept. If anyone ready also, I can tell. 3 minutes over. So one of you can tell for a cross-sectional study, one of you can tell for a case control cohort and where you're going to start, how you're going to do a study. It's just simple. Good, someone can try, ma. Anyone can try, volunteer?
Hello,
Yeah, yeah.
ma'am.
Which study? You want
Ma'am,
to study design?
does a hormone replacement therapy reduces or cause coronary heart disease risk in postmenopausal women? Right,
Yeah.
ma'am.
Mm,
So when I'm choosing a cross-sectional study, ma'am, I'll be
okay.
going PICOT. So like my population will be on postmenopausal women.
Mm.
And,
You don't. This is my research idea. I'm not asking to frame a research question. If you want to do cross-sectional study, how will you do it? Like simple thing.
okay.
Mm.
So I'll be choosing the postmenopausal woman, man.
Yeah, your
Those who
study very good.
when it's cross-section study, I'll be
Mm,
doing this study on
mm,
postmenopausal women, those who are
very good.
undergoing hormone replacement therapy,
Mm,
and I'll be checking the out. I'll be checking at that period of time whether they are having any coronary heart disease, or if they are already having the coronary heart disease, it is reducing or not, like
yeah.
uh,
1 minute is we don't know whether your hormone replacement therapy or reduces harm in it patient. So just you take a group of most menopausal women in a cross-sectional study. Huh? Then you ask them whether you are on hormone replacement therapy or not. At the same time, you ask whether you have coronary heart disease or not. So all this outcome, you have a definition. If it is a self-reported one, or whether you will confirm with your ECG or whatever, you can decide. So you will take a postmenopausal group, woman, and you'll ask whether you are a hormone replacement therapy or not. At the same time, you will ask whether you suffer from coronary heart disease or not. So you are measuring your exposure and outcome at the same time. This is your cross-sectional study. It's very good effort. Next, somebody can try for your case control study.
How would I give a try for a cohort, ma'am?
You can, no, you try. Who is who
This is
you
Manoranjani. Yeah.
yeah. You want me to tell?
No, I'll try out, ma'am.
You are trying for cohort study. You please
Yeah.
tell.
So if it is a cohort, I can take two study
Mm,
population. The
mm,
one with the coronary heart disease and the one that doesn't have. One will
mm.
be acting as a control, and another one is the people who has a coronary heart disease.
You think
And
an
then,
answer, no? You do want to do a
uh,
cohort study.
yeah,
Cohort study, where the study will begin?
uh, there will
uh,
be no disease, ma'am.
Yeah. So the
So
all right.
you will take
I'll
a
be
postmenopausal women and you divide them into two groups. That is, one is on hormone replacement therapy, another is not on hormone replacement therapy. So those who on HRT is
All right.
considered as exposed. Then you follow up them for a such period of time, some 1 year or 2 years. You look for your coronary artery disease, whether they develop or not. Okay,
Okay.
good. That's why I don't know where your study begins only decides.
Yeah.
And
So I
some
should
to
not look
some
into the heart disease. I should look into the hormone replacement and take it
yeah,
as a group.
exposure factor is here is your hormone replacement therapy. I have
All
a
right.
chance whether those who are having hormone replacement has a higher risk or thus they have a reduced risk due to HRT. That is my aim. So I want to do a research. I can do it because the factor decides. I want an immediate within a short period of time. I will choose a case. I will choose cross sectional or case control. So somebody can try for a case control also.
So when it comes to case control, ma'am, I'll be
Mm,
taking a case like they are
mm,
having a coronary heart disease, and
mm.
another coronary heart disease in postmenopausal woman, and another is
Mm.
normal people,
Yeah,
like
good.
at the same age group. So there
Good.
one has to be the case, another set group has to be the control. So they'll
Mm.
be under HRT, and we will be checking the whether they are having any reduced effects or not. Likewise, ma'am.
Here, what you will take? Your age will be a confounding factor. If you are taking your cases with என்ன சொல்றது older age group, that is above 50, is a postmenopausal women. If you are taking the younger age group, comparing with younger age group, normally they will be at lower risk. So here you should match. The major thing is case control study. For this, you can do a better. You take a postmenopausal women, you try to screen them for coronary heart disease. Those who positive for coronary heart disease will be considered as case, and those who are negative in the screening will be considered as controls. Then you can ask what we are discussing. Then you ask them whether they are having hormone replacement therapy or not. Yes or no factors. That is clear? Clear?
Yes, ma'am.
Clear.
So how we are not clear, ma?
Clear,
Somebody
clear,
wants to
ma'am.
ask? Clear. So again, if it is a RCT, you are going to give, you are going to divide. You take a group of postmenopausal women and you divide them into two groups who is going to receive hormone replacement therapy, or you are going to give some group of people and not to someone. You can compare the outcome. So you are intervening. So here this. So does hormone replacement therapy prevent occur? What we have seen is cross-sectional study, which is a simpler one. Here, disease and outcome are measured at the same time. So in a RCT, subjects are assigned to intervention, do not get to choose. So exposed to RTD, not exposed, you see the how many of them develop heart disease or not. If it is a case control, you are beginning with those who have heart disease and those without heart disease, and you ask retrospectively whether they have been exposed to hormone replacement therapy or not. Cohort, you choose subject with exposed and non-exposed. That means exposed to HRT, non-exposed, you are following them. So one thing you are going to remember is where my study begins. How I am going to. That is only you should remember before. Then your research question. So here choice of study. So your case control. You should a randomized control trial. Diagnosis, you can take your cohort study. Sorry. Diagnosis, you can do a cross-sectional or cohort. Prevention, you can do RCT when you want to study the effect of vaccination or something, can do a RCT. Meta-analysis, prognosis, can do a cohort study, how we progress from this. And if you want to give the meaning, values of why, how this why the students suffer or why the patients suffer, or this perception, or you want to give some meaning to the feelings, or this you do a qualitative study. Any improvement, you can do a RCT, some intervention and economic. So any study, all primary study design you can choose. When you want, there are so many primary study designs may be done on prevalence of anemia. I want to know what is the truth existing. Then you can do all this group primary, you can do a systematic review. The analysis part is called meta-analysis. So that's why it is called as systematic review is the high topmost. So depending on the type of questions, whether I'm going to study on the intervention or the prognosis, diagnosis, etiology. So all this will comes with the systematic review. But the second level is that is systematic review of level 2 studies only. So this will be our basic primary study design. If I'm going to study on intervention, it could be a better if I choose RCT. If I'm studying the prognosis, you can choose your cohort study. If you want to study about the diagnosis, you can do a cross-sectional study. Etiology, you can do about it. Cohort study. This PPT will be with you, so you can share and can have it. So this somebody can attempt it. Somebody, a researcher with a medium-sized grant, so money is very less, wants to study the relationship between exposure to in-home treated drinking water and diarrhea among children in 3 neighboring towns in comparison to tape water. All 3 towns use the same water source and treatment facility. Which study design should the researcher choose, and how might she find the relationship? So then somebody is using a home treatment, somebody is not using, but all they are getting only from the same water source. Somebody design, which study design you can choose if you want to study this. You can choose any number of studies. Anybody can try?
Ma'am, good evening, ma'am.
Yeah, good evening.
Ma'am, the researcher can use a cohort study to
Very
follow
good.
groups exposed and not exposed to home treated water and
Yeah.
compare the incidence of diarrhea.
Super, very good, ma. So you can take under 5 children in the study area. You can and you can see who are all using their filtration at your drinking water at the home and not using. So you can follow up because this diarrhea is a shorter duration because this is not a longer duration disease. So it is a shorter duration. So you can do even a cohort study. Very good, very good. Second, somebody can try. This word itself will go.
Ma'am, I have a doubt.
Yeah.
The researcher over here wants to look into the prevalence among 4 universities. So it can be like a multi-centric kind of study.
Yeah, multicentric, okay, that is not which study design you can do it. You
Cross-sectional
want to
study.
study the prevalence.
Cross-sectional, ma'am.
Very good.
Cross-sectional study.
Again, somebody can try it out like a ecological study. That is a geographical area of the college can be considered as. So they may have the health records may be there. What is the prevalence and whether they're using the facilities or not. You can do, but better will be a cross-sectional study. You can choose the entire college students and you can do or sample you can do it. So very good cross-sectional. Yeah. This study design you can try.
Cohort study, ma'am.
Why you want to cohort study?
Ma'am, it will be like 2 to 3 years. So we'll be taking two groups of people who
No,
breastfeed.
yeah, you misunderstood. Funders want the result within 2 to 3 years, but
Okay.
development of breast cancer will take longer period. No,
Nice one.
maybe a person at 20 years may develop at birth, giving birth, or then may not they have a kid. So 40 years only or developing 20 years. You really want to follow up that?
Maybe retrospectively, like case control,
Ah,
we can.
yeah, very good. You can do because all this it's your choice. When you have a adequate time, adequate fund, you can choose your cohort study. That I'm not telling it is no, but because it is given a result within 2 to 3 years, but the development of breast cancer is very difficult. So better we choose a person with breast cancer and women without breast cancer and ask whether you breastfed your child or not. All this you can give and you can give your report within 2 to 3 years. This could be your very good. This could be your case control study. You can do better choice. Mhm. Anybody can try.
Can
This is
it be
simply
RCT?
which study?
RCT, randomized control study.
Because have asked RCT will not tell description. No, it will find out the causal relationship with it. You are simply describing a person osteonecro whether they have taken a alendronate or not.
Case series, ma'am.
Ah, very good case series you can take. Even you can ask a patient with osteon whether they have taken alendronate or not. The same thing cross-sectional study can do. Case series, case report is very good. Can do it. Okay. So summary, as I said, your observational study designs and your epidemiological study designs are primarily divided into observational and experimental. Observational, you have your descriptive and analytical. In your experimental, you have RCTs. All the factors which decide your is your research question, whether I'm going to use comparison group or not, whether I'm going to confirm the hypothesis. Already you know there is some relationship, whether I'm going to confirm it, then you are going to do your analytical step. So where I'm going to begin and your time, fund and resources decides which study design I'm going to choose for my research idea. From your research idea, you're going to frame your research question depending on all these factors. So any doubt? Can we have some discussions? So I have not covered your uh, qualitative study design because it was meant only for cross section. I thought giving different study designs and brainstorming your will provide you to understand the concepts. Any doubts? If not, we can wind up. Shall we wind up?
Among these cross-sectional case control
Mm.
and RCT, ma'am,
Mm.
which stands high in this pyramid, ma'am? Like
RCTs. RCTs.
RCT.
Above RCTs, you can do a systematic review also. For this, you should you can choose any primary, which was your idea. You can sit in one place and you can do means it can be higher evidence because it is giving a multiple. You are taking the so many study primary research area from different parts about your topic. You are going to synthesize evidence on it. That also you can try, but RCT is a good job. But
Can a
all this. Uh,
can a student can do RCT, ma'am?
uh, that is RCT means you can do academic clinical trials. We are not doing anywhere. We are not doing our RCTs. We are doing it for our academic purpose. That is called as academic clinical trials. You can do it along with your some faculties. Anything is not can get the yeah because you are doing under some guidance. No, can do.
Yes, ma'am. Yes. Thank you. Thank
You're not really experimenting on it because all the drugs has passed all the phases only coming to your post surveillance only. So for academic purpose, your this academic clinical trials, this word is clearly explained in the ethical guidelines for human research participants. You can have this. So that is given RCTs been renamed for us for academic. It is called academic clinical trials.
you. Yes, ma'am. Yes. Thank you.
Any other doubts? So anytime you can contact. I have. So again, the like top of the pyramid, there was a question asked by Arun. I think so. It was answered. So systematic review, then as your RCTs you can do, but anybody can do because if you are planning for RCT, it's a systematic review. You have to register as in a Prospero,
Yes, ma'am.
like as we do for a clinical trials registry. No, so we are having a Prospero for your systematic reviews.
Yes, ma'am.
So any
Okay.
or basically all will be having doubts. So always you discuss with your guide or with the community medicine faculties. So you can have some basic ideas before you proceed. So anytime you can contact me if any needed, you can message me. So number is already left with you. You can have this PPT also. I have already shared. Okay, thank you. Thank you for
Thank you.
listening.
Thank you so much. Ma'am, can we end with a vote of thanks, ma'am?
Yes, ma'am. Thank you.
Over to Lalita. Thank you. Thank you so much, ma'am.
Good evening to everyone gathered here. I am Lalita from the batch of 2023, and it's truly an honor to deliver the vote of thanks for today's inspiring seminar, Designs that Define the Direction of Discovery, Study Designs and Research, brought to us under the prestigious AARAICHI'25 mentorship program. First, a heartfelt thanks to our esteemed speaker, Dr. R. Uma Maheshwari ma'am, for sharing her vast wisdom and practical insights into the art and science of research study designs. Your session has armed us with tools not just to plan research, but to propel discovery in new frontiers. Gratitude goes out to the organizers, the Indian Medical Association, Medical Students Network, and Junior Doctors Network, Tamil Nadu State Branch, for creating this invaluable space for learning and mentorship program. Your vision for empowering young minds is making a measurable difference. My sincere appreciation to the technical and support teams who ensured today's session reached us seamlessly both here and through the live stream. To all the participants and inquisitive minds, your engagement and questions made this a truly interactive and thought-provoking experience. Let us move forward, motivated and equipped to design research that makes a real impact. Together, may we always find the courage to question, as said by ma'am, and the clarity to design and the rigor to discover. Thank you all once again for being a part of this journey. Thank you, ma'am.
Thank you for all joining the session. Thank you.
Thank you so much, ma'am.
Thank you.